Good morning, and welcome to the Mental Health Support Network's event, the Georgia Mental Health Town Hall. I want to thank you all for joining us today on this chilly Saturday morning. We have some very educational and informative speakers lined up on our panel today. So grab your coffee or tea and let's get comfortable. It's time to have a real serious conversation about a matter that affects anyone with a brain. For some, it's a very difficult conversation. And for most of us, it's enough of a challenge that it creates a cultural stigma that creates multiple barriers. Today is a day for real talk. Stephen, can you cue the next slide? The Mental Health Support Network is a nonprofit organization created out of the abundant need to normalize, glamorize, and popularize mental health and wellness for those that need it. Normalization, popularization, and glamorization of mental health and wellness help to significantly reduce the stigma, the hesitancy, the reluctance, and help to remove some of the barriers to seek the care and support that individuals need to live a healthy, happy, and functional life. Mental illness, mental trauma, and mental distress cripple an individual's ability to live up to their best human potential. This is our core mission. My name is Astrid Ross, and I'm the founder of the Mental Health Support Network. I'm also a suicide survivor. My father succumbed to suicide at 26 years of age when I was only 15 months old. My dad was a Vietnam vet. He was a cardiac lab technician at Clayton County General Hospital and at South Fulton Hospital, which are now Southern Regional and Wellstar hospitals, respectively. He was a former high school and a Fisk University college athlete. His death was a secret and a mystery to me until recently, due to cultural and family stigmas. Ironically, in the death announcement of the newspaper article, it stated, and I quote, that the immediate family was unaware that Ronnie was ill at all. This is the hidden carnage of mental illness. It is sometimes hidden. It lurks beneath the cultural and the family stigmas. It robs us of our grandeur and our fame. Mental illness can be depressive and crippling. Mental illness can also be high functioning and capable, but still just as fatal. It steals the joy from life and can ultimately be the cause of many individuals' demise, while everyone around them is seemingly unaware. Stigmas and cultural norms have made poor mental health perpetual and a constant here in America. I founded this network in the hopes and the intention to fight viciously to remove these barriers, open safe space for conversations, and have visible, audible, and tangible access to mental health care to individuals that need help improving their mental wellness. What is mental health? Let's cue the video. Hey, Stephen, can you play our first YouTube video?
It's coming. I love technology.
Mental health is something we all have. It includes our thoughts and feelings about ourselves and others, how we relate to other people, how we function day to day, and how we cope with the ups and downs of life. Having good mental health is not about having no mental health problems. It's about feeling good enough about ourselves, being able to do the things that matter to us, and having the resilience to deal with the difficult situations we all experience in life. When talking about our mental health, it can be useful for us to think of it like a scale. Our mental health scale will move towards good or poor mental health depending on what's going on in our lives and the supports we have around us. There are things that can challenge our mental health and shift the balance of our mental health scale. These challenges can come and go over time. They may be brief or may last for many years. They can leave us feeling stressed, sad, worried, lonely, overwhelmed. Mental health difficulties rarely just have one cause. They're often an understandable response to having to deal with the circumstances of our lives and things that have happened to us in the past. While there are things that challenge our mental health, there are also things that can support it too. These things won't necessarily prevent challenges to our mental health, but they can help us cope with what life throws at us. They can help us achieve balance in our mental health scale. Mental health can be complex because our experience of it is personal and unique. But we know that the more we normalize conversations about our mental health, the easier it will be for young people and adults to seek the support they need when they need it.
First up on our panel of speakers is Hanif Muhammad. Hanif Muhammad is a religious and academic scholar. He's written 2 books on comparative religion and has written article publications. Hanif is a mental health professional who is both religious and secular education. Hanif uses a holistic approach to help individuals, families, and communities with their spiritual, mental, and behavioral concerns. He's also a co founder of a nonprofit organization aimed at promoting religious tolerance and educating non Muslims on the religion of Islam. A motivational speaker and lecturer who lectures both nationally and internationally, the field of mental health is his passion, where he helps individuals who suffer with substance use and other disorders. Welcome, Hanif.
Welcome. Thank you very much for inviting me on the panel. It's a pleasure to be here. So I was asked to speak about a little bit about what is mental health, and I want to take a somewhat non-traditional route to it. So what did we know about mental health, and how had our ideology about mental health changed in the last few years, especially within the last 2 years? So at one time, mental health was really looked at to see how crazy a person is. I mean, it sounds bad to say it that way, but if anyone said anything about someone having a mental health issue, the first thing that a person thought about was what's wrong with this individual. And it played out in ways where you would see something that was abnormal, that didn't go with everything that you would look at as being normal, as someone being crazy. No one really at the time took the opportunity to delve into what was happening to this person from a psychological point of view. Mental health is something, like the film said, it affects our lives, and it affects our lives in different ways. How do we see the world is dealing with our mental health. What are the things that make us fear that has to do with mental health? How do we have confidence within ourselves that deals with mental health? The hardest thing to deal with when it comes to mental health is that if there's a mental health ailment, it doesn't present like cancer. We don't have the same type of concern, or we really didn't have the same type of concern for mental health illnesses that we did for a physical ailment, because if someone said, oh, I have cancer, everyone is like, oh, I'm going to pray for you. I hope everything works out. Are you seeing the doctors? Are you getting the help that you need? Are you eating properly? Are you following all the instructions that were given to you? Because we understand that cancer has a very detrimental effect on the human being. Conversely, so does mental health. How does a person manifest the symptoms of a diagnosis that they received? If a person who is normally calm, cool, collected, and who's responsible goes out and does something that goes far away from their personality of what you know this person for, it's like, man, this person they just snapped. They went crazy. Not understanding that this person could have had their first episode of being bipolar 1, especially if they had a manic episode that lasts for, we have criteria. It would have had to last for more than 7 days the first time around. But when it comes on, what we have a tendency to do is to be dismissive. So in this talk, what I'm hoping is that we have the opportunity to really stop with the dismissiveness, the belittling of what people go through, and understand that this whole thing about mental health, when someone has an ailment like that, we should have the same compassion and say, are you eating right? Have you spoken to someone about that? How are you feeling today? Because what that person is going through can be detrimental to them. The more we allow people to know that, yes, it's normal to have a mental health issue, especially now. The pandemic has shown us a lot. During this pandemic, there have been quite a few things that have come on the mental health scene that other people can deal with. Number one, people are having adjustment disorders because they have to find a new normal. Number two, people are having isolation issues. Number three, people are reporting more anxiety. Number four, people are reporting more depression. And unfortunately, like Mrs. Ross with her father, sometimes people, when they aren't able to speak to people, when they aren't able to express to people what they think, because they feel like people won't understand, they have a tendency to sometimes take their lives. And where we are today, understanding mental health, knowing that it is as important as physical health, we shouldn't have those type of issues as much as we had them in the past. So mental health is your psychological well-being, how it is that you see the world, how it is that you process the world, and how it is that you can really have the opportunity to turn the mirror on self, to look and see how it is that you're taking care of things, to make sure from a psychological point of view, from a mental point of view, from a spiritual point of view, and from a physical point of view, where you get this physiological thing going on, how healthy are you? So this is mental health in a nutshell. I hope that that sheds a little light on the subject.
Thank you very much, Hanif. Next up in our program, what does mental health affect? Let's see if our backstage speakers are here. Let's go to our National Alliance on Mental Illness. Our speaker for today is Felicia. She's a representative from NAMI, the National Association of Mental Illness. NAMI is the nation's largest grassroots mental health organization dedicated to building better lives for the millions of Americans affected by mental illness. NAMI provides advocacy, education, support, and public awareness so that all individuals and families affected by mental illness can build better lives. Welcome, Felicia.
Thank you so much for having me here. And thank you all for being a part of this important broadcast. So my name is Felicia. I'm a senior programs manager at NAMI, Georgia. And yes, I just want to give you a little bit about what we do, the services and resources that we provide, a little bit about our community impact, our initiatives, and what you can do to help out. So first, let me just start with our services and our resources. We are a grassroots organization. Right now, we have 20 NAMI affiliates that are run by over 200 volunteers throughout the state of Georgia. That's all 159 counties that we cover. Our state office is only about 14 paid staff members that support all of those affiliates in administrative duties. And what those affiliates do that are local to your area, they're spread out evenly throughout, is they provide support groups that are free to the public, peer support groups for anyone who is living with or recovering from mental health condition, as well as support groups for families that have a loved one, are supporting, and sometimes both. They also provide classes, free classes for peer-to-peer, which is how to teach other peers to recognize their mental health condition, their how to live in recovery, as well as family to family, which is how to best support your family member and while maintaining self-care. We also have classes on one of our biggest ones right now is CIT Youth, which is crisis intervention training. We teach law enforcement, first responders, clinicians, how to recognize mental health conditions in youth so that they can get the help they need if they're in a crisis episode, as opposed to ending up in the back of a police car or ending up in the emergency room, and how to de-escalate those situations. If it's someone with autism spectrum disorder that's not necessarily acting out just to be combative. And so last year, we trained over 200 teachers to go out and train others in their communities. So we also offer programs in addition to groups, trainings, we offer presentations. So we go out into school districts and we teach ending the silence. I heard Astrid speak about how she's been touched by suicide in her life. And Ending the Silence is our program that we teach students and parents and community groups and churches on how to recognize those signs in our young people and how to be appropriate support for them. We also have in our own voice presentations where someone living with a mental health condition goes and tells the story from their perspective, and they've been trained in how to tell the story appropriately so as not to traumatize others or to add to the stigma. But the point is to destigmatize, to get the conversation going, and to let people take away words like crazy or nuts so that they can hear that these are people, these are my community members, this is my family member, this is my mother, my aunt, and put a face and a story to mental health. And another one is sharing your story with law enforcement, which is something we've just kicked off recently, and as well, people with mental health conditions who have been affected by, who've had run-ins with law enforcement because of their mental health, because of their homelessness or because of their addiction, and sharing their story and opening up that dialogue has been crucial. The other thing we do is advocate. So we help those affiliates advocate for mental health change. We have our Mental Health Day at the Capitol, which is coming up pretty soon, where we actually share stories with legislators and letting them know about the disparity that's out there, where we would like to see mental health treated the same as a physical health. Mental health, like our previous presenter said, it's something that everyone has, good or bad. And we would like to see the same treatment that someone receives for having cancer, someone could receive for having depression, anxiety, and PTSD, and to remove the stigma. It's not a weakness. It's not a matter of willpower. It is a condition that deserves support, recognition, and treatment. And the other thing last thing we do is we have our annual walk, which raises funds and awareness for all of this, which is how we're able to provide all of this for free. We have a few contracts and grants, but other than those few federally funded classes or trainings, most of our funds and our support comes from the community that we serve. So by providing these for free, we have donations. It's our biggest fundraiser of the years in October, our NAMI walks. And we just ask people to walk and raise awareness and support us in giving back to the community and keeping our staffing low and our volunteers high. The other thing I was going to mention to you is our community impact. So right now, I just looked at our most recent fiscal year report, which ended in April. We'll do another one this coming April. But as of last April, we served just under 25,000 participants, 25,000 people in the state of Georgia who attended classes and who received this training. We have certified 375 instructors to lead those trainings. So we have train the teacher classes, which I'm willing to share a schedule with you if any of you are interested in becoming a teacher to teach your community, to teach at your business, where you see a need in your schools. If you are a community leader, we invite you to become a trainer. And we certified almost 400 people last year and plan to certify almost double that over the next year. We had over 1,100 NAMI support groups that we offered, which was a challenge with COVID. These used to be support groups in person. We went all virtual, and we did lose some numbers, but we worked really hard to get those people back in support groups and get them the help that they need. And so right now we're running a hybrid, some in person and some virtual, and numbers are increasing, and that's great to see. Like I said, we have 20 affiliates. We have 56 educational classes and trainings. We have workforce development classes. We have offered over 300 NAMI presentations last year. I think we're aiming for closer to 800 this year. We're really pushing ourselves. We took about 2,000 calls on our helpline. We have a free resource helpline, which anyone can call in Monday through Friday, 9 to 5. It is not a hotline. However, if we do have someone in crisis who calls, we refer them or hand them over to GCAL for the 24-hour, 7-day-a-week crisis hotline. But when they call the helpline, they receive resources for anything, and especially specialty resources for any subpopulations. So I'll finish up real quick. Upcoming initiatives that we have. Our DE&I committee, Diversity, Equity, Inclusion Committee, started about a year ago. It was shortly after the protests began with George Floyd and Black Lives Matter. We saw the need, especially in Georgia, for conversations to be had. And so we started Crucial Conversations webinar through our Diversity, Equity, Inclusion Committee. And if you're interested in an upcoming webinar, we can send you flyers. You can reach out to me. My email address is education@namiga.org. And we have one webinar every month, and we have a panel of experts and people with lived experience. And we have those crucial, courageous conversations. We open the door, we destigmatize, and have the hard conversations that need to be had. It was very successful last year. Our next one is coming up on January the 31st, and I invite you to attend. Please reach out to me with an email. I'll be happy to send you the annual schedule and the information for the upcoming one. Those are initiatives that we have, more webinars, bringing on more teachers, increasing our number of volunteers. How you can help is to join an affiliate. You can contact us, go to our website, namiga.org, find an affiliate that's in your area or that you're interested in. It's low cost. I think we have a $5 open door for any family, up to $60, depending on what you want to donate to us, because your becoming a member is a donation to us, and that also helps us in our fundraising. But with that, you don't have to be a member to attend support groups or classes or trainings. Those are all free to you, free to the people you know. Join an affiliate, walk with us in October to raise awareness and raise funds, become a teacher. If you are interested in becoming an instructor, or if you're interested in having a presentation at your organization, at your school, at your church, reach out to us and we can get you one of those presentations on our books. That's what we do. And just want to close by saying mental health, Georgia, the state of Georgia was ranked 51st in the nation, they're including Washington, D.C., for access to mental health care. So we are absolutely last. But NAMI itself is the #1 grassroots organization for mental health awareness, training, support, advocacy, education. And Georgia, we're happy to say, is the #1 NAMI state organization. We have grown dramatically in our outreach, in our number of volunteers. We continue to grow. We invite you to grow with us, to increase awareness and to destigmatize and yeah, to help raise mental health awareness. And that's all that I have. Again, my email address is education@namiga.org. You can also go to our website at namiga.org for any of this information on how to become a trainer, upcoming classes. We have a calendar of events, and I invite you to join us.
Thank you so much, Felicia. And just to let everyone know, I recently became a NAMI lead presenter for the program Ending the Silence. So we have, as a network, actually gone in and provided these presentations to middle and high school students in school environments and mosques and churches. So we're available to provide that resource as well. Thank you so much, Felicia. Sheriff Kevo Taylor and the Gwinnett County Sheriff's Office have pledged to create a county-wide culture in which residents with mental health concerns are not criminalized for their mental illness. The Mental Health Task Force will respond to individuals in the community with mental health illnesses who are presenting in an acute crisis. The deputies will undergo extensive and ongoing specialized training in verbal de-escalation techniques, crisis intervention, team techniques, and philosophies, as well as recognition of severe mental illnesses, personality disorders, psychopathy, developmental deficiencies, and the like. The Mental Health Task Force in Gwinnett County Sheriff's Office will recognize community advocates for their rights, their safety, and the treatment of the mental ill in Gwinnett County. I welcome the Gwinnett County's Sheriff's Office Mental Health Task Force. Welcome, Lieutenant Maldonado.
Good morning.
Morning.
Good morning. I'm Lieutenant Maldonado. I am the commander of our mental health task force that Sheriff Kevo Taylor has brought to light as a new initiative that from when he became a sheriff here in Gwinnett County. I am a licensed clinician as well. And on that team, I have Dr. Dana Tatum, who was the director actually at our jail for about 20 years before he left and went to do work on the road. He is responsible for all the training that the deputies are receiving. Right now on our team, we have 4 deputies, and hopefully we're hopeful that we can grow. And they have received over 120 hours of training within de-escalation skills, live scenario training, and recognition of mental illness. They're doing really good, and they're out in the community. We have only been activated within the last 6 months. The program started last year, February. However, it took some time to get the training and things done. The team is out in the community, and they are intervening in situations where individuals may have some sort of mental health issues, and the police have been called out, and to see if we can get them services rather than taking them to jail. Right now in our jail, we have 426 individuals that have mental health issues and are receiving psychotropic medication. That is about $27,000 a month that the taxpayers are paying for these individuals to have this medication. Majority of these individuals are in jail for minor charges as small as criminal trespassing, disorderly conduct, and a lot of times they have terroristic threats where they threaten a family member. The problem we have here in Georgia is there is not a lot of places for individuals to end up, so they end up in jail. What we're trying to do is avoid that. Mental health is an illness, and just like Mr. Muhammad mentioned, it's no different from someone being treated for cancer. Our goal is to try to minimize that number. We have 427 inmates that are in our jail, really don't need to be there. A lot of them are deteriorating beyond weight loss and different things because they're not receiving the services that they actually need. Being inside of a jail facility is not where they need to be. Right now, as of yesterday, we've answered a total of 423 calls, and most of those calls that we've answered have come from community members calling about family members that they receive help. I am licensed, and so is Dr. Tatum. A lot of the programs that are out right now, most of them are like co-responders, which is a great program. However, as we know, there is a lack of clinicians, there are a lack of officers, and in every field there is a lack of. And so what we're doing is trying to give our officers all the information and the skills to be able to recognize these mental health issues and see what we can provide for the individual versus bringing them to jail. Dr. Tatum and I are out, and if our team is out on something and they need us, we definitely go out. We'll sign 1013s. Right now, we have had the privilege to be partners with Ridgeview, Riverwoods, Laura Heights, and Ridgeview, Laura Heights, and I think it's one other hospital. I have to look, I apologize. And they are willing to do direct admits for us, which is phenomenal. We're not trying to overcrowd our emergency rooms. So if we have an individual that a 911 call has went out on, example, we had one 2 days ago, a person called GCAL and stated that they were suicidal. However, GCAL, they hung up the phone. 911 was dispatched out. My team assisted with that call. We were able to get the female out of the home, talk to her. She knew she needed some help. Instead of taking her to an emergency room, because she did have insurance, and that's one of the things we know that is an issue. If they don't have insurance, it's very difficult to just do a direct admit. However, we were able to get her into Riverwoods. They come out to our vehicle. They'll do a swab for the COVID. My team is able to do these assessments. Again, they can't sign 1013s, but we have given them all the skills that they need to be able to sign these 1013s. To be able to do the assessments. And Dr. Tatum and I don't mind coming out and signing the 1013s. This way, we alleviate the long waits in the hospital, and we are able to get the person the care they need directly. And it makes it a lot easier for you to say that you need help if you're not stuck in the emergency room 12 or 14 hours. I worked at Emory for 11 years, part-time. I've been a police officer for 20 years. This year be 21. I was a school resource officer. I worked for the Sheriff's Department prior, and I came back when Sheriff Kibo Taylor decided on this initiative. We are a small division, but I promised our goal is to make a difference. It takes one day at a time, and we do what we can, but we do answer a lot of calls. I will make sure you all have my information. I would love to see how we can network and how we can benefit others in different locations in the community. May 7th of this year, we are going to do a Mental Health Awareness Day, and I would love for everyone to come out. We will have food and just everyone that's in the community that has some type of resources that they can provide for family members, or, just others that don't know what's actually out here. In Gwinnett County, I worked in DeKalb for many years as far as mental health. I didn't recognize that we really do have a lot of resources, but they're not advertised as much, and a lot of people are not aware of it. But this event will be held at Alexander Park in Lawrenceville, Georgia. It will be from 10 to 2. You can come out, you can set up booths, you can just bring whatever you would like to just give out information to the public. We will be announcing this and publicizing this event. I'm hopeful that it will become a really big event so we can give out those resources and let the community know what's out there. A lot of calls I receive from family members, a lot of times they don't even know where to start. And when they call 911, they are hopeful that the person would get help, not go to jail. And typically that situation always spirals out of control and the individual ends up in our jail. And because we don't really have a whole lot of advocates for mental health, they end up sitting for extended periods of time. Right now, we have 112 that I am working on to see how we can get the judges and the solicitor's office to get these individuals out of jail, because they don't need to be there and the charges are so minor. However, where do they go from there? And that's the biggest question. Where do they go from there? So it's very difficult for us to make a huge impact when we don't have facilities that can accept these individuals. Or if they do, the time that they are in these facilities are less than 10 days. So the individual end up back out on the streets and having issues. We're doing a backpack giveaway for the homeless, where we're going out to different sites. And if you have any information on places where you think would be great for us to go out to give them these backpacks with the jackets, blankets, socks, different things like that, we will start doing that next week with our another team that we have partnered with. So if you have any places that you think that would be beneficial, that a homeless population, that we can go out and give these individuals these backpacks with these supplies, please let us know. Again, I am Lieutenant Maldonado. Dr. Dana Tatum is our director. He does a lot of training. He has worked many, many years all across the world. Before he came back home here in Georgia, he was managing 127 jails and prisons, and he was over all the contracts for the mental health inside those facilities. So we have a lot of information. Again, we're a very new unit, and we're open to suggestions and information, and we would love to partner and come out to different locations just to speak on what we are able to do to decriminalize mental health. Thank you.
Thank you so much, Lieutenant Maldonado. This is such good news and good information coming out of Gwinnett County. We definitely, one of our initiatives is decriminalization of mental illness. And this goes a long way toward helping the community members of Gwinnett County. We're hoping that this awareness and hopefully broadcasting out and reaching out to other county sheriff's office and local police departments will also result in programs like these that will help to bring the mental health support and treatment that people need and to keep them out of the law enforcement cycle. Thank you so much for your time and your words. We appreciate it.
Thank you.
Now let's listen to what mental health sounds like at the legislative level. Here now is Senator Nikki Merritt. Senator Nikki Merritt is a progressive Democrat, retired telecommunications services professional, and a CWA Local 3024 labor union member. She was first elected into the state Senate in 2020 as one of the few new Democratic candidates in the state to unseat a Republican incumbent. During her first legislative session, Nikki focused her efforts on increasing voter participation, passing her first bill, SB 253, and fighting back against voter suppression policies. Senator Merritt believes in fighting for our most vulnerable populations, ensuring public safety, healthcare, and supporting women's reproductive rights. She understands the importance of working together to achieve common goals. As a servant of the people, she's committed to her core beliefs to improve the lives of others. We welcome Georgia State Senator Nikki Merritt. Good morning, Ms. Merritt.
Good morning. Hi, Astrid. Thank you so much for inviting me out to discuss very critical issue and an important matter especially as a result of what we're seeing, kind of a COVID fallout. But hi, everyone. I'm happy to join all of you today. My name is Senator Nikki Merritt. I represent the 9th District, and that is incidentally here in Gwinnett County, as we heard from our Gwinnett County Sheriff. And I also serve on the Committee for Labor and Insurance. And mental health, some of the mental health enforcement and what we will be requesting does fall under our insurance division and our insurance commissioner. And, we've reached a point where we are in a severe crisis as far as mental health here in Georgia. I don't think it's getting nearly as much attention, and definitely in attacking the problem in a way where at the level we should be. The Center for the Disease Control and Prevention shows that the psychological toll exacerbated by the COVID-19 it has made this problem even greater, and we're still battling, COVID, and at times it seems like it's no end. Sorry, you guys, this is my dog in the back. I apologize, everybody. And it seems like there's no end, and I think folks are feeling that as well. The pressure of, when are we coming out of this? And that is again this making the psychological effects more intense. People have suffered loss in so many ways. We're dealing with suicides, we're dealing with depression. There's an increase in violence and anxiety, and all of this, is increased at a moment because we are dealing with this pandemic. And what this has exposed in Georgia is our failure to really invest in healthcare access. Now we're seeing what happens when we don't have an infrastructure to support care for folks when we need it the most. So, the pandemic has exposed the holes in our safety net and the support that we should be giving people who are in crisis. We're even seeing it in our first responders. In our workforce. Our first responders and those we have to rely on are suffering from PTSD themselves, and they need mental support so that they can help those out there who make calls and need support as well when they have to go out for emergency care. I have personal experience with mental health and the effects of it in my family. My father struggled with mental health issues, bipolar, and that led to substance abuse. And in the African American community and in people of color specifically, we have a problem with a stigma with getting mental health care. It is a shame in that. It was for two reasons. There seems to be a shame or some a misunderstanding about what it means to get mental care. That's one problem. The other problem is the access of having it, affordability, having the resources out there, having the health insurance to get the care. And we know, if we're not providing those resources, people are less likely to go get the help. But again, we have a stigma problem as a whole in the African American community and communities of colors, and we just seek the help we need or identify the help we need. We also have in my family suffers from diabetes and high blood pressure, and those are inherited problems. And we diagnose and we treat those as a chronic illness and is covered by medical care, yet we don't do the same for mental health care. And honestly, insurance companies should be forced to cover mental health in the same way that they would a chronic disease like your diabetes and your high blood pressure. And we know that they have not been attending to that in the same way. So we have to challenge that stigma. 1 in 4 people with mental illness have been arrested, are getting thrown in jail, and 2 out of 5 of those individuals have a history of mental illness that goes undiagnosed. And we know if as I said before, when the mental illness is not diagnosed, a lot of times people turn to the substance abuse to deal with the mental illness. And what we do know is that early prevention has proven to be effective and a cost-effective solution to healthcare. Georgia must expand Medicaid, and what that will allow, especially those who are in that insurance gap, is to have the at least in they need for basic care, but also expanding that to mental health care as well. So what are our asks here? What do we need to do here in Georgia? We have to enforce the federal parity laws so that insurance cannot discriminate against patients about what they're treating. Again, we should be treating things like heart disease and diabetes the same way. Mental illness should be treated the same way things like heart disease and diabetes are treated. So we must put more pressure, or I encourage all of you to put more pressure on our legislators to make sure that the insurance commissioner is enforcing those parity laws, because we have no mechanism to make them do so right now. And I will say that I looked at our current budget as this has been budget week in Georgia, and I looked to see what the insurance commissioner office was asking for. And, still yet again, we're not spending enough money in enforcement of things like parity laws. And well, first of all, let me back up. We don't have the mechanism yet to make them enforce that. And then we do have to give them the money and adequate funding and structure to be able to enforce that. So there is a two-part measure here. And in our budget, I haven't seen money going towards enforcement at all. In fact, it looks like a lot of the budget money will be going to reinsurance. And basically, that's when insurance companies purchase from other insurance companies to cover their liabilities. So a lot of money does go there now. Our second ask is, make sure that the insurance commissioner is we're providing them at the state with the adequate funding so that we can hold that office accountable, and so that they can enforce the parity that we're requesting. I'm going to say again, we have to fully fund Medicaid so everyone can have affordable access, especially those in that uninsured gap. We also need to support programs for a certified peer specialist, and that will help those in the workforce. It will address the workforce crisis that we're seeing. Now, I will say we do have a bill. It's HB 855 that is coming from the House side, not my Senate side. And that is a bill to address the PTSD that our first responders are receiving. So write that bill down. We will need support from all of you guys to get that pushed through. I think that effort is a critical effort right now. We do have mental health legislation coming from the House side as well. I don't know. I haven't seen the full scope of it, so I don't have the bill number. I don't think they've assigned a bill number to it yet, but do look for that in the coming weeks as we go back in session next week. And if anybody wants to reach out to me, if you're looking to get more information about that bill, I'll be happy to give it to you. And last but not least, just really push your legislators, know who your local House and local senator is, and reach out to the Lieutenant Governor's office, reach out to Speaker Ralston's office. Lieutenant Governor is Duncan, and let them know that we need to start making mental health a priority, and any legislation that comes forward with that, we would ask them to support that. as well as we would like to see a bill to force the federal to enforce the parity law. So that's just a few things you can do as far as holding all of us accountable and reaching out to make sure that those in our leadership know this is important. It's important that they hear from you out in the public how important this is, and I think that will go a long way with helping us make this a priority this session. And I am hoping that it will be a priority. We shouldn't be prioritizing more gun legislation access. We should be making the mental health and health of our citizens here in Georgia a priority. So you can, I'm at nikki.merritt@senate.ga.gov. And it's just my name, Nikki Merritt, senate.ga.gov. Reach out to me with any ideas or any way I can support all of you out there. We had NAMI come on. They are a great resource. Matter of fact, they helped me with my resources. Volunteer for them. Really stay on top of the work that they're doing. They do great work. They help us in the legislature with our support needs as we frame our conversations and our priorities about mental illness. So with that, I think that's all I have to say. I thank you all again for having me today, and I'm really hoping that we'll make this the top priority or one of our top priorities coming up in this session. I can't hear you. I couldn't hear Astrid. I'm sorry, Astrid. I couldn't hear you.
Thank you so much, Senator Merritt. Thank you so much for your words. Thank you so much for this very informative session. You can definitely count on us to follow what is going on in our legislative arm of our government and make sure that we as an advocacy group are helping to push the progressive needle forward for mental health care in the state of Georgia. Next up, our speaker is Marcus Jones. Marcus Jones is a result-driven therapist that assists individuals in managing symptoms of mental illness, maintaining sobriety, resolving motivations for self-defeating thoughts and behaviors, and improving relationships. His experience is inclusive of adolescent and adult populations. Marcus is a licensed psychotherapist, certified alcohol and drug counselor, and certified anger management specialist. He earned his Master's of Science in Mental Health Counseling from the University of the Southwest, Master's of Business Administration, and a Bachelor's in Organizational Management from Ashford University. Marcus has worked in the field of mental health for 20 years. In the last 7 years, he's provided counseling services in individual, couples, families, and groups with experience in a range of settings from community counseling to inpatient treatment settings. He specializes in addiction, anger management, and men's issues. He served as the director of inpatient addiction and outpatient treatment services at an Atlanta-based mental health hospital. He's a former host of 102.6, The Situation Radio's Mental Health Mondays. He has an in-depth understanding of the different levels of mental health care and how they can best serve individuals suffering from mental illness. Welcome, Marcus Jones.
Hello, everybody. Thank you for allowing me to join you today and discuss an important matter: Black men and mental health. Well, there are a large number of Black men who are suffering from mental illness in silence, whether it's depression, an adjustment disorder, bipolar disorder, or what have you. There's many reasons as to why Black men don't seek treatment. One of the reasons could be their stage in development. Well, as a child, you're taught, don't cry, man up. What does that teach? That teaches avoidance of emotion. That also teaches that being angry is more masculine than feeling hurt. Could be a reason as to why you see many men from a broad spectrum overall show anger as opposed to being hurt. Could be a reason as to why you see many adolescents show anger as opposed to being hurt. It's social messaging. Think about the social messaging in our society about how a man is supposed to look, how he's supposed to act, how he's supposed to be. And at any point when they show emotion, they're questioned. Their masculinity is questioned. That causes a man to have to revert back to being silent because they don't feel safe. Creating a safe space is what helps a man be able to express emotion. To constantly face systemic oppression. Black men could see mental health as a part of that system. Because there are many other factors in our society that collaborate with that system. Think about the education system. Black males are more likely to receive harsher punishments than their peers in the school system. Think about the justice system. Black males are more likely to receive harsher sentences than their counterparts. And for many black males, the first time that they experience mental health is in the walls of a prison. And when it comes to mental health in a prison, let's just be honest, there's just not enough time. And there's just too big of a caseload of inmates because prisons are overcrowded to be able to do any sort of in-depth therapy. You're talking to a therapist who has experience working in a medium correctional facility. So when a black man can't get what he needs in his first experience inside the walls of a prison, when he leaves prison, he's more likely not to seek any sort of mental health. He's more likely not to want to even receive any sort of mental health because it's attached to a system in which oppresses him. Another factor is not many black men see other black men in the field. I'm often told as a therapist that I'm rare. I can remember a time where I was doing therapy with a woman who said that she was surprised that I was her therapist. Because in her mind, she doesn't picture a black man as a therapist. There's many things you can pull from that. But at the end of the day, I was glad that I was able to break her stereotype. And so, again, there's many reasons as to why black men don't seek out therapy. There's a reason why they attempt to do it alone or suffer in silence. It's a dangerous thing to do. And the reason it's dangerous is because suicide is now the #1 leading cause of death among black males between the ages of 15 and 24. It's a growing crisis. And as you know, we're in an epidemic within a pandemic. Suicide has increased within the last 2 years due to the pandemic and the rises in depression and the symptoms of depression and increased stress. And so now let me speak to black men. Black men, it is important for you to be able to seek therapy and to feel comfortable enough to seek out a therapist if you're going through increased stress. Therapy is not for you if you're crazy. A lot of people say, well, I'm not crazy. Well, if you're using that terminology to associate somebody who is in an acute symptomatic nature of mental illness, then there's more acute care. We wouldn't be able to treat that individual in therapy. There's inpatient hospitalization, there's partial hospitalization, which is a subacute care, and then there's intensive outpatient. So that hasn't even reached therapy. Therapy is for individuals who are stable enough to attend, who are conscious enough to be able to receive the revelations in a therapeutic environment. It is my job as a therapist to help you move from survival to resiliency. See, when you survive, if you're still living and breathing, then you're surviving. Because that's what it means to survive. Survival is the bar. But what about resiliency? Resiliency is the ability to withstand and recover from hardship. Well, that takes learning emotional regulation. And that's what we teach in therapy. But then it just doesn't stop there. Because once you realize that you're resilient, now you have to move to the step of self-efficacy. And that is my job, to help you get there as a therapist. And there are things we have to dig through, we have to discuss, because there may be roots of issues over time. Think about it. As humans, we're wounded as we go through life. And we understand that wounds are ugly. So what do? We wrap them. Think about when you have a physical wound. You take it, you wrap that wound. And if you're cut deep enough, right, and it's bleeding a considerable amount, you wrap it up until you're able to get to a doctor. And when you get to the doctor, what happens? You have to unwrap the wound. Once you unwrap the wound, the doctor is able to operate. Well, it's the same thing when it comes to therapy. When you come to a therapist wounded, our job is to first get you to unwrap the wraps in which you wrap that wound. Because it is only then we can walk you through the healing process. So it is very important to seek out therapy. If you're questioning as to whether there are Black male therapists, you see one right now. And there are others out there ready to help, who understands, at least from a broad standpoint, of the systems in which you go through in life, of the microaggressions in which you experience, of the stereotypes and archetypes in which society has placed on us. We're here to help. And there are more Black males in this field to come. In fact, there is a history of Black men, a long history of Black men that have been in mental health. And so there is a such thing. And so I encourage Black men to seek out treatment. But until then, if you're suffering from depression and stress, find someone in which you feel vulnerable with to talk to. Because it takes a level of vulnerability. Understand that it is normal human nature to express emotion. Men do cry, just as every other human being. We suffer just as every other human being. And it is a normal process of life. It is better to speak out as opposed to act out. We understand that you have survived Now it's time to cross the threshold in thriving. Thank you.
Thank you very much, Marcus, for sharing that information. Our next speaker is Dr. Arshad Qayyumi. Arshad Qayyumi will discuss how poor mental health can affect physiological health. Dr. Qayyumi is currently a tenured professor of medicine in the Division of Cardiology at Emory University School of Medicine and the director at Emory Clinical Cardiovascular Research Institute. Dr. Qayyumi also holds the Bruce Loeb Chair for Cardiovascular Research. He's a board certified cardiologist and a fellow at the Royal College of Medicine. He graduated from Guy's Hospital Medical School in London, and after accomplishing part of his medicine and cardiology training in London, he completed his fellowship training at Massachusetts General Hospital, Harvard University in Boston, and the National Institute of Health in Bethesda, Maryland. He was a senior investigator and director of the Cardiac Catheterization Laboratory at the Cardiology Branch of National Institutes of Health for several years before arriving at Emory. Welcome, Dr. Qayyumi.
Good morning, everyone. I hope all of you are doing well today. And it's indeed a privilege to be able to join this meeting and perhaps talk a little bit about stress and health in general, and particularly cardiovascular health, which is my specialty. I think in medicine, we have long recognized that even outside of just psychiatric illness, which largely goes underdiagnosed and underappreciated, both from the physician point of view as well as from the patient's point of view. But aside from that, we've also failed to recognize the true impact of psychological health on other conditions which we may not quite appreciate. So, for example, simple chronic conditions like high blood pressure and diabetes, which are conditions that affect perhaps the African American Black population in the US disproportionately. Even these conditions have a very serious or are impacted very seriously by psychological health. There is good evidence now to show that conditions such as depression and then also stress, just daily life stress, can exacerbate the tendency to develop these conditions. And if you have these conditions, then superimposition of mental disorders or psychological disturbance, such as depression or stress, can exacerbate the downstream adverse consequences of having these conditions. So, for example, high blood pressure can either be fairly well controlled and really lead to no real consequence during life, or it can be very poorly controlled, run very high levels, and be intermittently well controlled and cause damage to the kidneys, leading to kidney failure and dialysis, to heart disease, to stroke. These are some of the adverse consequences of having high blood pressure. And we can concentrate on high blood pressure because it's such a common condition in Black adults. And what we know is that people who have stress plus high blood pressure, or depression and high blood pressure, their control is poorer. Perhaps their access to medicines is not as good, or perhaps their compliance with treatment is not as good. And all of these things together lead to worse outcomes, even with conditions which are prevalent in the general population. But when it affects people who also have added psychological conditions, the common ones being stress or depression, and there are many others, PTSD, etc., these people have particularly bad consequences. There was one study that comes to mind that I guess makes a point of the importance of stress and heart disease risk. Is a very large study that was done internationally, not just in the US. Tens of thousands of people were looked at who had had a heart attack, and they compared them to people who hadn't, so-called control population. And one of the 9 risk factors that contributed to heart attack risk was just stressful life stresses. It was almost as strong a predictor of risk as perhaps was smoking or diabetes. So having depression or stress, and this can come in many different varieties, of course, and I guess in the short time we don't have time to get into the details of what these things really can encompass and how you would measure them and so on. But nevertheless, just answering some questions, 3 or 4 questions regarding stress at home, stress at work, etc., was enough to identify higher risk population that I said as almost as important a risk factor as perhaps is smoking or having diabetes is for developing heart disease. So just to underscore what I think my task was today was to say that mental illness, and often it's very subtle, it's not even considered an illness. Maybe 1 in 5 of us will have an episode of depression during our lifetime. And a lot of us will have depressive symptoms much more frequently. And these conditions are almost part of life because they affect such a large swath of the general population. And it's worth recognizing that the frequency of it, worth accepting that is generally goes underdiagnosed and undertreated, and appreciating that it is not unusual to have these things, that it doesn't mark you or identify you as somebody who is something wrong with their head or the brain. This is really almost a something that one is going to go through in one's lifetime, almost certainly to a certain extent. So it's something that needs to not have the kind of feeling that people have, oh, I don't want to admit the fact that I'm depressed or stressed out because, it will look like there's something wrong with you mentally. There are all these feelings that individuals have that stops them from even expressing these feelings to their families or to their physicians, which then delays the diagnosis and exacerbates the impact of mental illness that it has on your general health. So I'll stop there, Sister Saida, and thank you very much for inviting me.
Thank you very much for your informative presentation, Dr. Kayumi. Thank you for your time.
You're welcome.
Next up in our program, Khalil Shakur. Khalil Shakur is the head development coach and group fitness instructor at Morris Fitness. My mission, speaks Khalil, is to teach a community health and nutrition as a lifestyle. Every day I work with athletes to develop championship habits in all areas of their lives. I believe success is a habit that can be developed over time. Khalil is going to speak to us today about taking charge of your fitness, nutrition, and your mental health. Welcome, Khalil. You're muted.
All right. Good morning. Here we go. Can you hear me? Great. All right. So I just wanted to talk to you guys today about a few things involving health and fitness and nutrition. There's a big need for better fitness and nutrition in our community as a whole. Black people, we have the most health problems. We're the highest on the percentage charts in diabetes, heart disease, and I think depression as well. So a lot of what we're experiencing is a symptom of a lack of knowledge in health and nutrition. So no one's health is perfect, as we all know, especially their mental health or their physical health. You can't be perfect, but you can always do something to work toward being better. And that's really what I want to talk to you guys about today, right? Like your lack of fitness can really affect mental health big time. Okay. So what I really want to talk to you guys about today is just really what I do day to day is really to work with people in their habits. I think all of health and fitness can be broken down into creating good habits. If you can do that, you'll simplify a lot of it and things will kind of make sense. So the first thing that I really wanted to talk about was just having consistency with good habits versus bad habits. Bad habits would be things like binge eating, binge drinking. Some people don't. They do things like they won't eat breakfast or they won't eat all day, and then we wonder why we don't feel well the next day or at night, or why our emotions get a little crazier at night. But your gut health affects like everything in your body. Your gut biome creates a lot of the hormones that regulate your brain and the rest of your body, as well as your insulin sensitivity. That also will affect your mental health to some degree, and your glucose intolerance. So those are all three things that you can really control with your diet and with fitness. Okay. So we're going to move on to eating healthy. Okay. So a healthy diet, really, I feel like everybody knows what to do. The problem is we don't know what not to do. Okay. Eating fruits and vegetables is what you want to look for, right? You need to eat healthy food, food that's nutrient dense and that's going to keep you satiated all day. So that means complex carbohydrates, that's beans, that's rice, all kinds of potatoes, vegetables, things like that. But I'm more focused on the things that we shouldn't be eating. A lot of times we can't differentiate what's really healthy and what's not. The first thing we need to worry about, in my opinion, is sugar. Sugar is going to negatively affect your mental health in all capacities. Okay. So that's the first thing we can get rid of. Definitely get rid of the sugar. Okay. The second thing is artificial sugar, right? Everything that says no sugar on it, if it has that on the label, that means that they're putting artificial sugar in it. That can also affect your gut biome. The sucralose is pretty known for giving people upset stomachs, and part of why that's happening is because your body, it can't absorb some of the minerals in your body as well as it's absorbing sucralose. So that causes some problems in your guts, and that inversely will affect your mental health, right? The second thing is not drinking enough water. We can definitely drink a lot more water. Your body's 70% water. So in order for your brain to function properly, you need to be able to filter water through your system all day, not just a couple of times a day. All day, your body needs to be filtering water. We need to be getting hydrated, and drinking a lot more water than colored drinks and caffeine. All right, so moving on. The next thing is watch things that are on your labels that say vegan or fat-free or sugar-free or low fat. Typically what happens in those products is they're very processed. Okay. You wouldn't have to put high in fiber on an apple because it's just high in fiber, right? So a lot of times if there's things on labels that seem inconsistent with what you're buying, like a vegan apple, Okay, I would be very timid to buy that. So definitely watch your labels, and watch anything that has artificial sweeteners, artificial sugars, and a lot of things that are very processed are not going to be good for your health at all. Okay. So moving on, back to your habits. So 2 things that we can do to create better habits are give ourselves better cues and better rewards for doing the work, right? Doing the work is the hard part. That's the waking up in the morning and making breakfast instead of running through McDonald's. That's putting down the processed pizza and going ahead and making some spaghetti for your family instead of making the pizza in the oven, right? We need some rewards for that. So you got to identify a cue, identify a reward for everything. Your cue is going to be how you're feeling when you don't want to do it. Your reward is going to be what you get when you finally do it. So make a great meal for yourself, make it healthy, add as many vegetables as you can, add some spice in it, and make it healthy. Anything that you're going to buy from a store, it's going to lack in the nutrition department. So make sure you're cooking it, make sure you make it at home, and it's going to be a lot more nutritious for your family. All right. Last thing I wanted to talk to you guys about is just exercise, and how you can create habits with exercise. Okay. The easiest thing that you can do for your health is just go take a walk. A lot of times we complicate fitness. What you'll see on social media and on the internet are a bunch of people going crazy in the gym 3 hours a day, 7 days a week. But that's not, you can't be consistent with that. Most people can't. So the easiest thing that you can do is find one thing that you can do per week, one singular hour every single week, and go on a walk. Right? When you can do that for 5 weeks straight, then you can add something else, right? Start jogging, make it a longer walk. You can go take a HIIT class. You can go take a cardio kickboxing class. But just 1 hour a week will get you started with that, and get consistent for 5 to 6 weeks. Okay. Don't overburden yourself with fitness. If you do that, it'll overcomplicate it and you'll tend to stop doing it. If it's an easy thing for you to do and remember, you will tend to do it better over time, and for a longer period of time. So consistency in health and fitness is very important. It's key. It's key. Another thing, habits form slowly. Over time, your brain will use less energy to form habits and to keep yourself in the routine. So although I know in the beginning, eating healthy and exercising all the time, it feels like a burden, and it feels like it's a lot of effort for you. But over time, your body will use less effort to do the same thing. Okay, so stay in the habit, keep it simple, and keep it consistent, and you'll tend to do it well over time. Okay, I appreciate everybody listening to this, and I appreciate you having me on this mental health podcast. Thank you very much.
Thank you, Khalil. And you all can tune in to Khalil at Morris Fitness on Facebook and Instagram. Thank you so much. Next up on our podcast is Daphne Bennett. Daphne Bennett is an internal medicine MD candidate for 2023 and a mental health coach. She pursued a biology major undergraduate at the University of Puerto Rico, followed by a graduate degree in medicine at the University of Medicine and Health Sciences, having completed all her clinical clerkship, her last 2 years of medical school at Emory University Hospital in Atlanta. She became interested in mental health upon finishing with her medical school curriculum. Having experienced firsthand the consequences on mental health from painful life events herself due to the lack of support system and access to health care, it became very clear to her that changes needed to be made to achieve it in an urgent manner. She has done extensive research on functional medicine and how a holistic approach to health in general can profoundly improve the state of mind of a patient. In the future, Daphne plans to run a medical clinic where patients are provided with this unconventional but effective holistic approach to health. During her spare time, Daphne enjoys staying active and connected to nature with activities such as rock climbing, horseback riding, and longboarding and painting. Please help me welcome Daphne Bennett.
Hi,
Welcome, Daphne.
good morning.
Good morning.
Thank you for having me. So today I have been asked to talk about ways that we can improve individual mental health care. And I could talk here about, going on walks under the sunshine, getting your vitamins in, having better nutrition, exercise more, drink more water, things that we already know, etc., right? But I would like to have a different approach and go straight to the root of what I believe is the root of the problem. The more obvious and simplistic way that comes to mind is to improve access of care to all economical strata of our society. Money should never come in the way for treatment or management in maintaining the sanity of our people. So I decided to talk about 3 different but very essential ways our government should and could play an active role in the bettering of this issue. First off, we need more doctors. Although this may sound quite familiar to everyone in this room, very little is done in regards to this serious issue. It's not that we don't have enough people willing and doing the work to become doctors, it's that we're not allowing those same people to execute their goals. To give you a rough statistical data and very rough percentages, did you know that last year, only 94% of our residency spots got filled with MD candidates? Although this may sound like a quite high number, only 78% of those people that applied got matched into such residency programs, meaning that about 16% of those graduated doctors end up being jobless under an immense amount of financial debt. Talk about the best way to affect your mental health, right? Now, the 16% may sound like a very small number, but when you take in consideration the thousands of applicants each year, this number adds on. Meanwhile, we still experience a 100% deficit in doctors around hospitals throughout the entire country, especially in those small community hospitals taking care of the less affluent people. How does that make any sense? If we're not offering enough jobs for these doctors, then we should also not be offering this many spots in medical schools, period. However, this is another issue for another conversation. The moral of this story is, allow these well-prepared graduated doctors to serve our country. This will alleviate the need of doctors issue. It is the easiest and most straightforward way to help in the issue. We must also hold insurance companies accountable. People are unable to afford healthcare in America like no time before. To give you an example, I did not meet one single healthcare worker with health insurance in the community hospital I did my last elective rotation at. They claimed the hospital did not provide health insurance to them, and although being highly educated, they could simply not afford it. Again, how does that make any sense? It should be the government's responsibility to take care of our society, especially when first responders, nurses, paramedics, doctors, are essential for the welfare of our society. Finally, mental health care should not be a when you're sick kind of issue. When we should approach it in a preventative way. This will not only benefit patients, but the medical community as well, since less saturation in doctors' offices, less medical errors due to exhaustion, and less burnout doctors should be accomplished this way. This means that instead of teaching our children to hide or run to safety in case of a shooting scene in school, we should be teaching our children mental health care hygiene with the same emphasis or even more so than we do with math or English literature. The healthier individuals we raise, the healthier our country will run, the more success we will have, and the less of a financial burden and emotional crisis our country will have. As I close my statement today, I can say that mental health is the one field in medicine that has affected every single person in this room right now, whether it has been directly or indirectly, from the less severe form to the more severe form, suicidal symptoms. We all have been affected by it at one point or another. Eliminate the stigma. Let's start talking about it earlier in schools, and let's work towards prevention of this disease. What America needs to be great again is to run on a more stable, balanced, and dependable society, and healthcare is the answer. Thank you for your time.
Thank you so much, Daphne. Thank you. What a way to close out our program. Thank you so much for your information, your informative session, and your inspiration.
Thank you.
Now that we've shared so much information with you, the job is yours. Now it's your turn to help. Please use these resources to share with your family, to use them for yourself, or please share our program, our event online to those that may need this information. Sorry, a little technical difficulties. I want to thank you all for joining the Mental Health Support Network's event, the Georgia Mental Health Town Hall, where our job is to help save lives and improve the lives through education, advocacy, and action. Thank you so much and have a great day.